Medical question of the day, number 2. A 67-year-old man presents to the emergency department with crushing central chest pain radiating to his left arm. The pain started 45 minutes ago while he was resting. He is sweating profusely and feels nauseated. His ECG shows ST segment elevation in leads 2, 3, and a VF. What is the most likely diagnosis? A. Stable angina. B. Non-ST elevation. Myocardial infarction, NSTEMI. C. Inferior ST elevation. Myocardial infarction, STEMI. D. Pericarditis. Comment your answer before scrolling down. Correct answer? C. Inferior ST elevation. Myocardial infarction, STEMI. Explanation. This patient has all the classic features of an acute myocardial infarction. Severe crushing central chest pain. Pain radiating to the left arm. Sweating and nausea. ST segment elevation on ECG. The ECG findings are the clue. ECG leads area of the heart. 2, 3, a VF inferior wall, V1 to V4. Anterior wall I, a VL, V5 to V6 lateral wall. Because the ST elevation is in leads 2, 3, and a VF, the diagnosis is an inferior STEMI. Why are the other answers incorrect? A. Stable angina. Usually occurs on exertion. Improves with rest or nitrates. Does not cause ST elevation. B. NSTEMI. May have ST depression or T-wave inversion. By definition, does not have ST segment elevation. D. Pericarditis. Causes chest pain that is relieved by sitting forward. ECG typically shows widespread ST segment elevation, not just in 2, 3, and a VF. High-yield exam Pearl. Remember Arshan. 2, 3, a VF equals inferior MI. V1 to V4 equals anterior MI. 1 a VL, V5, V6 equals lateral MIA. Quick way to remember it is F equals floor. The inferior wall is the floor of the heart and is represented by the inferior leads 2, 3, and a VF. Bonus challenge. Which coronary artery is most commonly involved in an inferior STEMI? A. Left anterior descending, LAD. B. Left main coronary artery. C. Right coronary artery, RCA. D. Circumflex artery. Bonus answer. C. Right coronary artery, RCA. This type of two-part question keeps medical students engaged and encourages them to learn beyond simply selecting the correct answer.